Shortness of breath and lung signals. Warnings from WHO. Knowledge for lung disease prevention. Hello friends. Shortness of breath is never a normal state, but is an urgent signal showing that your bodies are severely lacking oxygen. In this video, we will go straight to the core issue, accurately identifying which shortness of breath is related to lung disease and which is due to other dangerous causes such as cardiovascular or metabolic disorders. Small changes related to respiration are very easily overlooked, but if these manifestations are not correctly recognized and monitored timely, they can progress into dangerous chronic lung diseases affecting health and life long term. We will analyze based on current medical guidelines from the World Health Organization and leading universities in the United States, helping you clearly understand when a respiratory symptom must be considered a survival warning. Before going into the detailed analysis content, please subscribe and turn on notifications for the MMM channel with the YouTube handle at MMM. And now, we begin the main content. One is, we need to go deep into analyzing types of shortness of breath directly related to damage in the lung parenchyma and airways, an issue that the World Health Organization identifies as a leading global disease burden. According to actual data from WHO, lower respiratory tract diseases are the third leading cause of death in the world, taking the lives of millions of people every year. Shortness of breath due to lungs, also known as organic dyspnea, arises when alveolar sacs are damaged or bronchi are narrowed due to chronic inflammation. At prestigious medical universities in the United States, such as Johns Hopkins and Harvard, experts emphasize that shortness of breath due to lungs often progresses in an oxygen-starved manner, meaning you feel unable to inhale enough necessary air, even though the chest has expanded to the maximum. The most important identification feature is that this feeling often increases when you perform physical activities, even the lightest ones, and is often accompanied by persistent coughs lasting over 3 weeks or wheezing sounds coming from the chest. 2 is the difference between shortness of breath due to lungs and shortness of breath due to the cardiovascular system is a deep field of medical knowledge that you need to recognize meticulously to avoid mistakes in emergency handling. Shortness of breath due to the heart often occurs because the heart is not strong enough to pump blood, causing fluid to stagnate back into the pulmonary blood vessels, creating a state of pulmonary edema or congestive heart failure. At leading hospitals in the United States, doctors often differentiate by observing the time of appearance. If you find shortness of breath more intense when lying flat and must prop up high pillows to be able to breathe, then that is the pointer sign of cardiovascular disease rather than pure lung disease. Conversely, shortness of breath due to chronic obstructive pulmonary disease often creates a feeling of air being trapped in the lungs, making exhalation difficult and longer than usual. WHO statistics show that more than 3 million people die from chronic obstructive pulmonary disease every year, and most of them have confused the initial symptoms with the state of physical decline due to old age. 3 is, we must consider a type of shortness of breath that is extremely common but completely unrelated to lung structure, which is shortness of breath due to psychology or generalized anxiety disorders. According to empirical research from psychiatric experts in the United States, hyperventilation syndrome often appears in people facing extreme mental pressure, causing them to breathe fast and deep unconsciously, leading to the elimination of too much carbonic gas and creating a false sense of suffocation. You can distinguish this type of shortness of breath through the phenomenon of tingling in the fingertips, lips, and feelings of intense heart palpitations, but the blood oxygen concentration, when measured with specialized devices, remains at a completely normal level. This is completely contrary to shortness of breath due to pneumonia or pulmonary embolism, where blood oxygen drops seriously and requires urgent mechanical ventilation intervention. Understanding the nature of psychological shortness of breath will help you avoid unnecessary panic, while focusing on breath regulation techniques to rebalance the central nervous system. 4 is the state of shortness of breath due to anemia and systemic metabolic disorders is a vast content that WHO frequently warns about in public health programs, but is still often missed. When your bodies are severely deficient in red blood cells, the ability to transport oxygen to tissues is significantly reduced, forcing the lungs to work twice as hard to compensate for this deficiency. A feeling of breathlessness in this case is often accompanied by a pale complexion, pale conjunctiva, and frequent exhaustion even when not active. At medical academies in the United States, a blood count test is always a mandatory step to rule out the cause of shortness of breath due to anemia before conducting complex diagnostic imaging techniques at the lungs. In addition, another dangerous form of shortness of breath not originating from the lungs is Kussmaul breathing, commonly seen in diabetic patients with ketoacidosis, where the body tries to breathe very deeply to expel acid, demonstrating that the lungs sometimes are only the organ executing orders from serious disorders occurring in other parts. 5 is sounds emitted during shortness of breath, such as stridor or wheezing, are extremely valuable physical signals to determine the location of damage in the respiratory system. According to the American Lung Association, wheezing is often a sign of obstruction in small bronchi, commonly seen in asthma or chronic bronchitis. Conversely, if you hear a laryngeal stridor when inhaling, that could be a warning about a foreign object blocking the airway or acute laryngeal edema, which is a life-threatening emergency in just minutes. WHO recommends that any strange sounds emitted from the chest need to be described thoroughly to the doctor, because they reflect the narrowing state of the airflow when passing through narrow segments in the bronchial tree. Correctly recognizing the sound helps us distinguish between a common bronchial asthma attack and a serious upper airway obstruction, thereby having the correct handling direction and protecting life timely. 6 is the feeling of chest tightness accompanied by shortness of breath is a warning index of damage to the pleura or pulmonary blood vessels that you absolutely must not underestimate. Lungs inherently do not have sensory nerves, but the pleura surrounding them is extremely sensitive. When there is pneumonia or effusion, each breath will cause painful friction like a knife stab. In the United States, chest pain accompanied by sudden shortness of breath is a classic sign of pulmonary embolism, a state where a blood clot blocks the blood flow to the lungs, having an extremely high mortality rate if not treated during the medical golden hour. WHO points out that pulmonary embolism is often missed due to rather vague initial symptoms, but the combination of rapid breathing, chest pain, and rapid heart rate is the dangerous triad signaling that survival is being threatened. Deeply understanding the link between the feeling of pain and the breathing rate will help you be more alert to respiratory emergency situations that can take away lives in a blink of an eye. 7 is environmental and occupational factors are becoming leading causes of silent lung diseases that the World Health Organization continuously calls for global attention. Inhaling fine dust, chemical fumes, or toxic mineral fibers at the workplace causes interstitial pneumonia and lung fibrosis, making the gas exchange area shrink gradually over the years. Shortness of breath in this case does not appear immediately but progresses very slowly, starting from slight breathlessness until the patient completely loses the ability to breathe on their own. Medical universities in the United States have proven that damages due to occupational lung dust are often irreversible. Therefore, prevention is the only measure to protect long-term health. You need to be aware that our lungs do not have the ability to completely self-recover like skin cells, so all destruction from the environment will leave permanent scars, leading to incurable chronic respiratory failure in old age. 8 is the role of measuring respiratory function and modern diagnostic techniques in quantifying the level of shortness of breath is extremely important according to United States medical standards. Spirometry not only measures the amount of air you inhale, but also measures the speed of the outflowing air, helping doctors clearly distinguish between obstructive lung disease and restrictive lung disease. WHO recommends that all people with a history of exposure to tobacco smoke or working in polluted environments should perform periodic lung function screening to detect the disease right from the stage without clear clinical manifestations. When we have specific numbers about lung capacity, treatment will become more accurate and effective instead of just relying on the vague subjective feeling of the patient. Applying scientific progress into monitoring respiratory health is the way we master destiny and protect life before the negative impacts of diseases. 9 is prevention measures and pulmonary rehabilitation according to international standards are bringing new life opportunities for those living with chronic shortness of breath. WHO emphasizes that annual influenza and pneumococcal vaccinations are the most effective lung protection methods against dangerous acute infection outbreaks. Besides, diaphragmatic breathing and pursed lip breathing exercises have been proven at rehabilitation centers in the United States to significantly improve gas exchange capacity and reduce the feeling of breathlessness for patients. You need to understand that training endurance for auxiliary respiratory muscles is as important as training for heart muscles or limb muscles, because it helps optimize the meager amount of oxygen that the damaged lungs can absorb. Persistence in maintaining a healthy lifestyle, staying away from pollution sources, and practicing correct breathing is the key for you to regain initiative in each daily breath. 10 is understanding the close link between the lungs and other organ systems will help us have a more comprehensive and profound view of respiratory health. Lungs never work independently, but always coordinate closely with the circulatory system to nourish the whole body. Once the lungs weaken, the cardiovascular system will have to work overtime to compensate, leading to the risk of multi-organ failure. WHO calls for a multidisciplinary approach in treating diseases causing shortness of breath, from adjusting an antioxidant-rich diet to well-controlling blood pressure and blood sugar indexes. When we and you raise awareness about this complexity together, we will no longer just focus on treating surface symptoms, but will aim at protecting the entire sustainable life-sustaining system. Consider each peaceful breath as a testament to the health of a great biological machine operating non-stop inside you. 11 is, we need to analyze deeper into the state of paroxysmal nocturnal dyspnea, a serious warning sign often confused between asthma and left heart failure. At leading medical universities in the United States, this symptom is studied thoroughly because it reflects the pressure change in pulmonary blood vessels and the sensitivity of the airway when the body rests. If shortness of breath is accompanied by high stridor and a history of allergies, the probability is high that you are experiencing an acute bronchial asthma attack. However, if the shortness of breath makes you jump up to breathe and is accompanied by leg edema, that is a blunt warning about the heart condition being exhausted. WHO emphasizes that accurately recording the time and circumstances of the appearance of the shortness of breath attack will help doctors save precious time in providing a life-saving treatment regimen. 12 is the importance of maintaining a reasonable weight, and the impact of obesity on the breathing mechanism is also a medical content we want you to take to heart. Excess fat in the abdomen and chest area exerts direct pressure on the diaphragm, reducing lung volume and making you always in a state of breathlessness, even though the lungs are completely healthy. Studies in the United States indicate that obesity hypoventilation syndrome leads to chronic oxygen deficiency and increased burden on the heart, no less than other chronic lung diseases. WHO recommends weight management is not just an aesthetic issue, but is a direct measure to release pressure for the respiratory system, helping lungs operate more freely and effectively. When you reduce the physical pressure on the chest, each breath will become lighter and deeper, contributing to improving overall health sustainably. Finally, we need to emphasize that lung health never declines in a day, but is affected gradually over time by the indifference and subjectivity of humans. Each persistent cough ignored, each slight shortness of breath underestimated, and each time health checks are delayed all contribute to increasing the risk of serious long-term respiratory damage. International health organizations and leading experts all affirm that early recognition of abnormal signs, clearly distinguishing shortness of breath due to lungs or due to other causes, is the most important foundation to protect respiratory capacity and quality of life. When humans correctly understand the signals that the body emits and act timely, the lung disease burden can be minimized to the maximum. Actively monitoring respiratory health not only helps prevent disease progression, but also contributes to maintaining a more active, sustainable life for the future. If you find this content useful for yourself and your family, please subscribe and turn on notifications for the MMM channel with the handle @MM. On these two media channels, we will continue to share in-depth content on protecting the lungs, liver, kidneys, cardiovascular system, and common non-communicable diseases under a meticulous scientific perspective. Health does not come from luck, but is the result of correct understanding and choices made at the right time in the right method. Thank you for following the entirety of this important video.